Hello and welcome to the AfOx Digital Insaka. It's great to have so many of you joining us from around the world, as always, for this month's Insaka. My name is Watu Amai, and I'm here to introduce today's speakers and topics. One of the talks today is on safe drinking water. We all recognize the enormity of the challenge facing many communities in our world. And this is in spite of the potential role of water treatment technology. Well, we'll hear why that is the case, and specifically why monitoring water quality and generating the data required for meaningful application of water treatment technology is critical. Our second talk fits right in there with a focus on how the African Academy of Sciences is changing the face of science in Africa by ensuring that researchers and research institutions across Africa flourish and drive advances in science, technology, and innovation for improved livelihoods. We are delighted to welcome Katrina Charles and Tom Kariuki on our panel today. Katrina Charles is Associate Professor at the School of Geography here at the University of Oxford. She's an environmental engineer, and her research focus is on improving access to safe drinking water and sanitation. Katrina is co-director of the REACH Improving Water Security for the Poor program, which addresses water security challenges in Kenya, Ethiopia, and Bangladesh. Her work addresses the role of human behavior in achieving water security, management of water-related health risks, and the impact of climate variability and climate change on water security. And Professor Tom Kariuki is Director of Programs at the African Academy of Sciences, where he leads the Alliance for Accelerating Excellence in Science in Africa, otherwise known as AISA. AISA is a funding, agenda setting, and program management platform of the African Academy of Sciences. Tom has also had a stellar career in mainstream academia and is an internationally recognized immunologist. Scientific excellence, research leadership, and innovation for the transformation of Africa's future is really what drives Tom. At AISA, he oversees the funding of research and development, the commercialization of high-impact solutions, and the formation of strategic partnerships with academia, government, and industry globally. Now, a few pointers for how this session will proceed. Each speaker will give a 15-minute talk, and following both presentations, respond to your questions, which you will have posted online. So please do send us your questions via the YouTube chat. Now then, our first talk, Achieving Safe Drinking Water for All in Africa, Opportunities for Innovation. Katrina, please.
Thank you, Watu. I'm just going to put a few slides to share today. And as Watu mentioned, I lead a number of programs looking at water quality across Ethiopia and Kenya, as well as Bangladesh and South Asia. And so based on this, I wanted to share what I see as really the opportunities for innovation to really advance safe drinking water for Africa. So I've got a few graphs here on the first page, which I want to highlight. So the first graph on the left shows over the past 2 decades, basically, there's been some really good progress in improving access to water supplies across sub-Saharan Africa. So you can see that there's been an upwards trend in rural and urban water, and that's equivalent to over 320 million people gaining access to at least basic water in that period. So roughly 20 million a year, which is strong progress. In the second graph, though, you can see that there's been little change in access to safe water. So while you've seen there's been an increase in access to basic water, we're not seeing the same progress in terms of the safety of the water. In urban areas, there is a differential between rural and urban areas, with urban areas being about half the population having access, but that hasn't changed in that period. Overall, the estimate is there's about a third of the population of sub-Saharan Africa have access to safe water. So this, of course, is just an approximation. The data is a bit scarce, but it means that about 2/3 of the population are drinking water at home that's not safe. And that means there's a risk to their health, maybe not from one drink, but potentially over a lifetime of consumption. And so it's important to think about what the contaminants are then that we're worried about in unsafe water. So of course, there's fecal contamination. So one of the biggest concerns remains contamination from human and animal feces, which can lead to diarrheal diseases and also contributes to chronic diseases. So most of the data on water quality is focused on fecal contamination. That's what I'm going to talk about mostly today. Another type of contamination, though, is geogenic contamination. So in the photo on the bottom, where we're sampling water in Kenya, that's one of the things we're concerned about there is contamination that's come into the water from the rocks and sediments in that area. And so that might be things which are potentially of benefit to health in terms of micronutrients like magnesium or iron, or it might be things which have quite negative impacts on health. So at high concentrations, fluoride, for example, is a big issue in this area, but it could be arsenic in other areas as well. And of course, there's increasing pollution issues that we're concerned about. And so when we look at this picture, we look at this challenge in terms of access to safe water, one of the first things people often jump to is treatment. Great, we can treat, we've got lots of different treatment technologies available, low cost treatment technologies that we can use to treat this water. And there's a lot of innovation in this space, and there has been ongoing lots of innovation continuing to try to develop new technologies. For example, bone char treatment is one which is used to remove fluoride, and that is one which has been readily available for a long time. It is used reasonably widely, but we still see fluorosis as a major issue in high fluoride areas, despite this knowledge and this and having access to this kind of technology. So what I'm interested in more is then where are the opportunities for innovation that relate to water quality? And so to understanding water quality, so that the user, the manager, has access to understand, do they need treatment? Is this an appropriate well to use for this purpose? And how might they manage it better? And so this is one where we've come across, again, with the bone char example. This was some work I did in Kenya with a student, where while there were kiosks that were providing defluoridated water with bone char, the people who were managing those kiosks didn't have access to information on the water quality. They didn't know when they needed to change the media they were using to make sure that it was continuing to provide high quality water. This is a study by Trent et al., which from a few years ago is an example from India, where they took water quality information. They used either lab tests for E. coli or these home test kits that are shown in the photo. And they were able to demonstrate that giving this specific water quality information, even at a household level, resulted in improvements in water quality. So we can see that data is important in this. It's not the only barrier, but it is certainly one where we know there's an absence of information. In this study, they were only able to look at it over 2 months. So they had, they'd give a household their test results, particularly if it was from a lab test, and then they followed up for 2 months. What we would expect based on behavior change is that that wouldn't be sustained, that improvement. But what we need is a way to get that information to people more regularly, get them access to that data that's going to help to stimulate that behavior change going forward, whether that's at a household level or at a community manager or utility manager level. So I wanted to highlight two challenges or two opportunities for innovation in this area where the industry's become a little bit constrained. One is around the technology we use to measure risk, and the other is the approach that is taken to how we set up monitoring programs, how we embed that information into monitoring programs. So firstly, in terms of the technology, what this child is measuring here is E. coli. So this is a fecal indicator bacteria that's commonly used, and it's what we measure mostly. The first thing we focus on in water quality is trying to make sure that there is no fecal contamination and reducing the risk from pathogens. So E. coli has been used for a number of years, and has been the preferred drinking water quality indicator since 1993. And in the past 2 decades, as we've seen this push for safer water availability, E. coli has increasingly become locked in as the main indicator that we use. And this is a sculpture of E. coli from an exhibition here in Oxford last year. So E. coli's had this really, it has a long history. It was discovered in the 1880s and so it's been around a long time. And it's been really useful in improving water safety in pipe systems in northern latitudes. And there's a reason for that. It's because it works best as an indicator in situations which are low temperature and have a low amount of nutrients available for growth. It's also that E. coli is very sensitive to chlorine. So if you can detect E. coli in a chlorinated piped water system, it's a very clear indication that that system is not working properly. However, if you take it outside those parameters, if you take it outside a chlorinated system, especially into warmer temperatures, so if we think about the hand pump which was being sampled on the first slide, E. coli is less useful because it can colonize the environment and grow in soils and in water. And so it means when you get a test that's positive for E. coli, you no longer know whether it is a contamination incident of fecal contamination or whether it just indicates something about the soil locally. And so part of the issue is that it's perhaps not always the perfect indicator, but it's also that this lock-in, this reliance on this one single test really affects the innovation in this area. Because E. coli is just an indicator. It's not correlated with pathogens. There is some association with diarrhea in small children in some settings. But when we focus just on E. coli, people sometimes forget that it's actually the health impacts that we're interested in. What we want to know is, are people going to get sick, not whether is there E. coli in the water. And so what we find is people are now, most of the innovation is focused on faster tests for E. coli or cheaper tests for E. coli. And other tests always get compared back to whether there's E. coli in the water or not, which is not what the intention is behind it. And that's limiting some of the innovation. The second part I wanted to mention was about how we monitor drinking water quality. And so the word monitoring is defined by this notion of keeping track of something, an ongoing nature, the taking of periodic and programmed observations or measurements. And it's about being designed for a purpose, that you're actually monitoring to test something in particular. Too often we find that monitoring is limited to compliance monitoring. So here is a review that was done of 32 water utilities and surveillance agencies across 7 countries in sub-Saharan Africa. So for these, they were looking at E. coli and fecal indicators. So compliance monitoring, again, often means that we're focused just on E. coli because we're focused first on that microbial safety. What they found in this study was that about 85% of the institutions had conducted some microbial testing of water in the previous year, but that means 15% had been doing no testing. What they did find is those who did testing, that it wasn't as much as they would have expected. And as you can see in this graph, most of the tests were done, the percentage of samples on the left for all categories, most of those are for piped on plot or public tap and stand pipes. There's very few, for example, for tube wells and boreholes, which are a very big source of water. So compliance monitoring then is very important in these, it is very important, but in these small systems, we're not getting the information we need to really make decisions about how to improve water quality. It's not frequent enough. It's not giving us enough of a pattern that we can understand the water system. And often that data is also not available in a timely manner to the people making that decision. So for compliance, one of the issues with compliance monitoring is that it needs formal accredited labs. So where we work in Kenya and Kitui, the nearest appropriate lab is in Nairobi. So by the time you've taken in transport and analysis, it means you'd be lucky to get a result in 3 days, and it would often be much longer. So before we test for compliance and work out whether something actually is complying with guidelines, it's useful to first answer the question to validate whether it can meet those targets. Can we get the information first to work out, will it ever meet those targets? Under what conditions will it meet those targets? Rather than just testing, having that one piece of data about whether it does meet the targets or not. So there are a few options then for innovation around these areas of how we think about these things, both in terms of the test we use, but also in terms of how that test might fit into a monitoring system that's designed to support improvements in water safety. And there's a range of tools that are available and in use in different places. But too often we find that E. coli is just held up as that one critical test that has to be done, and other things get ignored. So some of the examples of innovation, as I mentioned at the beginning, there's the E. coli test kits. So this gets rid of the transport issue. In rural areas, we've got if you've got a long distance to go to a lab, having a test kit in the household can reduce that time significantly. We've been working with a probe that measures tryptophan-like fluorescence. So this is looking at bacterial activity, and it's because it's a probe, it's giving you an instant result. So rather than sending a result away and waiting several days, you're getting that result instantly, and it can really has a different way of communicating with the public and with water managers about their risks. And the other work we've been doing is looking at moving away from compliance testing to more dedicated field labs, where you've got teams going out regularly, who live locally, who can go and discuss their water quality with people and give them results quickly so that they can act on those as well. One of the issues is that none of these innovations is ever going to replicate that E. coli test that is done in a fully accredited method in a formal laboratory. These are not going to get that level of confidence in the data, but they will give you data that can help people make decisions more quickly about water safety. So if we reflect back then on that first slide and the data that was presented there, where I said that a third of the population in sub-Saharan Africa have access to safe water, that is perhaps not surprising now that is based on very scarce evidence, very sparse data. So you can see on the map, the main part of that, there's only a few countries where we actually have data. The grey areas don't have data. So improving water safety then, well, improving water safety is incredibly important for achieving health gains, both in terms of communicable and non-communicable diseases. But it is also an opportunity for innovation to achieve safe water for all. And the innovation we need really is that innovation of water quality monitoring and testing, that we can have different ways to understand risk, to communicate that risk with people who are making these decisions, and different ways of managing the water. I think that's especially relevant in research where people are thinking about testing and doing treatment technologies, that there is water quality monitoring data really built in from the start in those programs so that people have access to that data. Thank you.
Thank you, Katrina, for that great presentation and the great clarity on the issue at hand. We shall now move on to our second presentation, and it's on shifting the center of gravity, 10 achievements of the 5-year ESA journey. Tom, over to you.
Thank you, and hope I'm audible and fully visible, and I've shared my screens. Thanks very much for the opportunity. I just want to spend a bit of time in the first part of this to just, saying a few obvious things about Africa before we get into the journey that you have taken, because it's obviously for Africa been a long journey of millennia. Historically, I think for Africa, there has been science, there has been some level of technology, there has been some level of innovation, whether one is looking at the great universities like Timbuktu or looking at the pyramids. The billionaire Elon Musk doesn't believe that it was built by Africans or Egyptians for that matter. He thinks they were built by aliens, so to speak. But we have lots of work that has gone in terms of discovery, for example, the human origins around East Africa, South Africa, and the building of the Great Zimbabwe, and one of the things we celebrate at the African Academy of Sciences, for example, is the practice of arithmetic in parts of the historical aspects of Africa. The 1990s, 1900s, 1960s, there is this emerging post-colonial African continent built upon, for example, the independence. And what we see is that 60 years ago, there is a dawn of independence for many African countries, very much focused on three challenges that they wanted to overcome: literacy, diseases, and poverty. And we are a continent that is very youthful, that requires the literate population. We have high disease burdens for a continent that is also going through an epidemiological transition. And we have poverty, large number of people, close to 400 million people who still are living in extreme poverty. So despite the dawn of independence in the 1950s and 60s, these three challenges remain very much the driving force for overcoming, for using science, technology, and innovation. The African Academy of Sciences, where I work and where we are based with a large group of fellows and staff, more than 500 fellows of the African Academy of Sciences, a group of program leaders who are based at the Secretariat in Nairobi. It's been built over 35 years, and it's been built around recognizing excellence. It's been built around building think tank. But I think it's a seminal event and momentous issue was the creation of this new platform called the Alliance for Accelerating Excellence in Science in Africa, AESA. This was done in 2015 with support between the African Academy of Sciences, the African Union Development Agency, or NEPAD, and our global partners, particularly Welcome, DFID, and the Bill and Melinda Gates Foundation. All of them coming together to say there is a momentum that can be built around funding and really building around the issue. How do you get funding? How do you do agenda setting? How do you then manage programs that are being driven by Africa and everything that is being independent, African-led, and the Africans taking the shaping of the science agenda? This is the big driver that led to the creation of this AESA platform at the African Academy of Sciences with regard to shifting the center of gravity for African science. And what I would like to spend is to spend a bit of time going through some of the things that has been happening. Obviously, nothing is complete of work. It is really very much progress of work. But I want to focus on a number of issues. One is around the question of, is Africa attaining scientific quality and productivity? Now, there has been great increasement of both the quantity and the quality of its research output. However, this still covers only less % of world research output with regard to Africa's output. Even though when you look at the last two decades, you'll find that there has been a doubling of articles published out of Africa. So for us and for the continent that wants to get into the body of knowledge across the globe, it's been a good trajectory of growth of outputs from Africa. It is still far from what one would like to see, given the fact that for a 17% of a population, there's that just 1% or thereabout. Now, if you look at health sciences specifically, and as an African Academy of Sciences, we are putting a lot of resources into health sciences. There is growth, approximately 4% annual growth in terms of health sciences outputs. And this now accounts for about 45% of all the research happening in sub-Saharan Africa. So a lot of money coming, either it is being driven internally or it's coming from externally, is actually going into health sciences research. One of the examples is one of our biggest flagship programs called Deltas, Developing Excellence in Leadership Training and Sciences in Africa. Since 2015, when it was launched as a partnership between Welcome and the African Academy of Sciences and the Department for International Development, DFID, at my last count, 1,200 publications over the last 5 years. And there are lots of policy and product outputs that are coming out from the leaders. And I put the quote here from one of the leaders, Professor Zombe Dongo, who is based on UKZN in South Africa, Durban, South Africa, who put out on behalf of his Delta's network, and he is celebrating the 5 years of the work that they have been doing under that. And there are other 10 other networks that similarly have a lot of data and information they want to share. A second area we've been driving is, are we growing young scientists in Africa, and are we supporting women in science? Now, we all talk about receiving or reaching a critical mass of scientists. Yes, I think there are advances. We are getting closer to that so-called critical transformative or critical point of mass of researchers. And I again use a quote there from Francis Collins in one of our meetings with us, where he said that he feels that given all the NIH support that has come to Africa, there could be an approaching tipping point for R&D and science in Africa. And we have a lot of grantees recruited over the last 5 years, more than 2,500 researchers across the continent in various R&D areas, everything from basic, translational, and implementation and social sciences. We see and we want to build emerging leaders, those who are what you might call a growing army of, including epidemic frontline researchers who have been in the trenches, so to speak, because they learned a lot from the Ebola crisis, and they were involved, they were taught, they were mentored during that period, and they are now emerging and their own leaders. COVID-19 now is an emerging, challenge for all of us, and these emerging leaders and established leaders are, they are on standby to address these new challenges. And gender, with regard to our own programs, is the fact that intentionally and being driven by our policies internally, we have made it a requirement for all of our programs to attain a level of gender parity and gender empowerment as we recruit students, whether it's their PhD, MSCs, or postdocs that are being coming on board. Unfortunately, every time we put out a call for opportunities for money funding, only about 20-35% of women scientists actually are in that pool. But that goes back to much deeper issues that are hindering the advancement of women's sciences, not just in Africa, but I think globally. A third area is what we mean by this shifting of center of gravity and how we can use it to promote equitable partnerships in Africa. So intra-African collaborations, we know, for example, that if you look at all the articles that come out of Africa and you look at how many of them are truly intra-African collaborations, there are very few of them, less than 5%. So 95% of these collaborations is great, but it is mostly being driven by North-South rather than inter-African collaborations. And we would like to see this rebalancing so that more and more Africans are working together to address common challenges together. So in terms of equitable partnerships, that has been, I would say, a bit of a bane for Africa. There's been the sort of so-called unequitable collaborations that you hear about all kinds of things like helicopter scientific adventures where people come and they collect serums or biospecimen and it is shipped out of the continent, and then there is sufficient attribution of the benefits of these people who are doing the work. So that's something we are trying to address, and I think this is being driven by a lot of policies, and there are many organizations globally that wants to see fairness, equity, and these sort of things become embedded. In terms of knowledge, yes, there's better understanding of these attributions. A lot more work is required with communities, for example. What is the benefit for these communities? How do the local policymakers move forward with the data and the evidence that's being accumulated by the scientists? And how do we get into the reinforcement of all the major programs driven for us? We see that, for example, the 10 principles that have been developed by UKCDR, we have adopted some of those, actually, equitable partnerships as a way of driving this achievement. There's a question around whether we are reaching more productive, impactful inter-African collaborations. I go back to that because I wanted to emphasize the point that when we look at some of our big flagship programs, and I mentioned two of them. There's one, Deltas, but there's also the Genomics Network that brings together 500 researchers in Africa. One of the things we want them to do is to actually recruit the lead institutions using this Harvard spoke model. So the lead institution takes a lot of the back of the resources, but we want them to bring on board partners who receive part of the budgets. And we want some of the partners to come from disadvantaged, the lowest of the low income countries, so that we begin to build capacities in some of these. So this again is very intentional in our policies to make sure that when Deltas and Teach Africa recruit 2,000 young scientists, these young scientists will become the next leaders. And we know that they'll be based on 100 universities currently for these 20 networks between these two programs. And that means that there's a lot of intra-Africa collaborations that is being actually birthed, nurtured as we do this. And I just wanted to mention also that the UK particularly, for example, with the Deltas Africa, there are 24 UK institutions that actually are part of the Deltas. And that's because it is providing mentors, resources, access to R&D platforms that are actually then helping us to drive these impactful intra-African collaborations. With regards to centers, one of the challenges that we've been addressing ourselves, and you hear this quite often, is where there are resources, is it going to just the usual suspects, with resource, so to speak? And one of the questions that we want to see is, yes, there have been large investments made by partners, global partners, whether it is Wellcome, NIH, DFID, CEDA, the World Bank, lots of investment made in a number of countries. It's a handful, considering that we are 55 African countries, and not counting the other one that are fictional, countries. We have a lot more work that needs to be done to go into more countries and more partners, and making sure that there are new emerging centers of scientific advancement or scientific excellence, whatever we mean by that word, excellence. We want to see more of that. One good example, for example, is we launched this clinical trials community platform. We want to bring all the clinical trialists, sponsors, leaders who work in clinical trials in Africa to build a network around clinical research and clinical trials. What we did, a bit of mapping, it shows us that there could be a minimum of 50 plus institutions, centers, sites in Africa who have good infrastructure, they have good clinical research, and they have done the experience with clinical trials. And many of them have the readiness even to be brought on board to deal with epidemic and other diseases. So this is an example of how we want to see more centers, more institutions emerging as centers in Africa, and they can actually be attracting more resources moving forward. Another area is the area around science producing high value jobs for Africa. We've been asked often about this. So there are not many high value jobs in Africa, because for most of the PhDs and postdocs, what we see is many of them are to be found in academia or much less in policy work in Africa. The opportunities for major biotechs or biopharma companies that are based in Africa that are leading discovery or translational sciences, not many of those. We've been discussing recently about whether there are a number of manufacturing entities in Africa that could actually be involved in the COVID discussions allowed whether there could be manufacturing of vaccines in Africa. There is only a very handful number of institutions or even private organizations in Africa that have the capacity to do vaccine manufacturing. There are a few, Senegal, maybe South Africa, Nigeria, one or two others. But we know we have created thousands of high value jobs through, for example, the payroll that we are paying the thousands of young scientists across Africa. And more recently, we have gotten into this partnership, for example, with some of the big pharma, including with Novartis, where we have industrial engagement with them to train for young scientists for 2 years at a campus in Belgium to see whether we can get more and more involved in various jobs in that industry. Another area is funding for all these countries, and that map there is really depicts the fact that we have been disbursing a lot of money the last 3-4 years to across many countries. So we have more than 30 countries receiving money that has been mobilized. So we've mobilized close to $300 million over the last 5 years. 70% of this money is going to infectious diseases work. And therefore, we are also thinking about how we begin to also put a lot more resources as they become available to this epidemiological sort of transition with NCDs, non-communicable diseases coming on board, and pandemics, climate, social, natural sciences. All of these are important areas which we should be putting money into. Now, we think, however, that Africa should be making investments that are millions, billions of dollars to build capacity. A lot of this has to come from Africa. It has to come from governments. It has to come from businesses and philanthropy. There are platforms that we have built, including, for example, the Coalition of African Research and Innovation, and working with AUDA and NEPAD to find ways of bringing more money out of the continent itself, so that even as global funders come on board, there will be matching of funding that actually is coming from this pot of money that is being created. It is still very, very early days to get that. Then on the question around whether there are communities are celebrating science in Africa, again, this is a good question for us that we want to pose. Yes, we know there are lots of higher education institutions that have grown from less than 50 in the 60s to more than 3,000 today across the continent. Communities across the continent, they want to see more science-driven actions. I think from data, evidence, getting into decisions by government. I think we can all have a long discussion about how governments have actually done science-driven in the context of COVID. So in that context, I think there are more questions around government and how that is impacting science advisor, how is science advisory impacting communities is an important question. And through our global funders and governments, we always ask the question around value for money. Is a continent less sick in terms of saving lives? Is there an increasing burden of infections? Yes. Non-communicable diseases, mental health is a challenge. Climate change is a challenge. And what we have done is we have developed at the African Academy of Sciences guidelines on community and public engagement. And we have a team that is trying to think aloud how our programs can be shared with CPE implementers, how they can be advised on how to develop effective engagement strategy with communities. Another area of our work is another age-old question around who sets the agenda for science, technology, and innovation in Africa. An interesting one. In this era, new large cloud of COVID that is hanging over us, many research leaders are getting into discovery, development, and future delivery of whether it is controls, tools, vaccines, or treatments. However, the resources have always been limited. There is a real fear that, for example, vaccines could be hoarded from the billions who are developing it, but are they going to be available? So that issues around equity becomes in. What we want to do is to make sure that we have conversations with the researchers in Africa. The agenda setting is being set at the highest levels, whether it is at the level of governments, national strategies. We, as an academy, we are very closely linked with organizations in Africa, whether it is the African CDC or with the strategies for the African Union, to make sure that the agenda is being set at the right places. What we are driving currently is white papers around some of these areas, around whether it is MNCH or genomics in Africa or climate change or epidemic preparedness. We're driving a lot of white papers and policies in those areas, and that's an area of development that we want to see more moving forward. And then one last area is around who really cares for reaching these targets for science R&D for Africa. Well, We are supporting and we are strengthening a lot of research and academia systems through policies, open science, financial governance, issues around research management. We ask questions around, do governments really care? Because if they have arrived at certain targets, we would want to see more budget allocations for R&D in Africa through their annual budgets. Of course, this requires a lot of advocacy, and only a few governments are approaching that allocation of 1% in Africa. Very few are approaching that. And therefore, we take the note, for example, and the encouragement from the World Bank in a report that says that the expectation is that everybody will see acceleration of research and research-based education in Africa, and research to build human capital in Africa. And actually, this is an area where all of us collectively as partners, engaging a lot of governments, identifying champions, whether they are political champions or policy champions who can drive some of these agenda moving forward. And then finally, let me summarize by saying, yes, looking at the 5 years, it's been a great journey of 5 years of building this ISA platform at the African Academy of Sciences. And if somebody asks us whether we have attained value for money for all the things that actually have been invested by our partners globally, I think we are seeing the real change in terms of how the mass of people, researchers, the armies, tackling disease burdens, building capacities for research, strengthening governance and weak accountability systems, the challenges around water and food and energy. Those are impacts that very much driven also by climate change. And we have a group thinking aloud and working groups across the African Academy of Sciences, including fellows, including grantees, including researchers. The question around value jobs, I have said, it's really something to worry about moving forward. Translation of science so that this move from data to evidence to decision making. Significant increases in financial. This is a good level of our platform ISA to be mobilizing that level of funding. But I have said a lot more investment is required, and therefore we need to see more and more significant resources coming out of Africa. And then how we then position STI as hugely relevant to science, to socioeconomic development, is something that we will continue to do with many partners, not just in Africa, but across the globe. That's what I wanted to share. Thanks for the opportunity, and we hope that many of you engaged with the African Academy of Sciences will continue to collaborate and to partner with them as we look for the next phase of the ISA platform for 2020 to 2025. Thank you for the opportunity.
Thank you very much, Tom, for the phenomenal presentation. In fact, both presentations have done a good job in focusing minds and putting a bit of fire in the belly. So we'll go straight on to questions because there are very many questions that are coming in. This has generated quite a bit of interest. And just to give Tom a bit of a break, I'm going to begin with a question for Katrina. There's somebody who's wondering what happens when you do this in situ testing of water when contaminants are found. What does the community do? Do they have innovative solutions as alternatives, or is it more about finding another source of water that is safer, or is it using other more straightforward or rudimentary approaches such as boiling the water, or what exactly happens, or filtering it? What do the communities do?
Yeah, that's a really great question, because it's not just enough, obviously, to have that information. It's how people use it, and do they have what they need to actually make use of it. And so it very much depends on what the data is saying. And what kind of contaminants it is. So there's all different types of responses that we've seen. Some we're working with teams who have been more interested, for example, in using chlorine and chlorinating supplies, and thinking about how they can use that if they can access it. We've got in some places some water supplies, it's very difficult to treat them if they have, for example, we have some very saline waters that we come across in Katui. And so it's very difficult to treat those in a way that's appropriate in that environment. But what you can do, for example, is to mix the water with rainwater so that it dilutes the salinity and you have a more palatable water at the end. So I think part of that, though, is having the scientists who can interpret that data and share potential. The water quality scientists are also closer to the people who can share with them what might be the appropriate way to deal with it.
Okay, thank you. And just to zoom out from that micro level, Katrina, into a more sort of macro level, there's a question here that's talking about the development of Africa depending on water. And they want to get your sense of what you think about the centrality of water and development in Africa. And of course, with regards to the SDGs, and we do know that the African Union has an agenda to 2060. Perhaps you might want to share your thoughts on that.
Yeah, I mean, that's such a huge challenge. There is, so one of the areas we work is in Ethiopia, for example, where you've got these areas of incredibly rich water resources, or seemingly very rich water resources, right next to areas which are very water scarce, and trying to get a balance between water availability that can really help support development in both those areas and support the development of people as well as of industry and the economy is quite a difficult challenge. I'm not sure that there's a simple answer for all of Africa, but more that there is in all these different areas, it's about understanding those water resources in that larger sense and the interactions between them so that effective decision making can really make the most of it without harming those downstream. Often we see that the poorest are the ones who are left with the most polluted water or lack of or water scarcity issues. You're trying to find ways in which we can really bring equity into some of these water decisions. Water decisions will be very important.
Thank you. And now a question directed towards Tom. I know that on one of your slides, you highlighted the question of science advisory and science engagement. And there are two related questions here. One of them is asking about how the African Academy is involved with African leaders to develop policies that support science and innovation. And also linked to that, how does the question of science diplomacy play out at the African Academy of Sciences?
Thanks. So the engagement in terms of how we then get into priorities, for example, is driven largely in a number of areas. So one is where you mobilize and do surveys across all the continent for leaders who are working in a particular area. And therefore, just as an example, when we decided that agenda setting was very, very important for COVID-19 in Africa, we did webinars, and those brought on board above close to 1,000 people who wanted to make contributions, how the science would be driven and how that would then eventually engage with policymakers and how that will engage with communities. In terms of the high level engagement, we are very much working, like I said, with, well, another example, again, giving the example of COVID-19, the work with the Africa CDC has been very, very important, because one of the things that they are doing very well is to make sure that there is a forum for policymakers, there is a forum for governments, there is a convening that is being driven by them and also for the African Union on a regular basis to bring together the African ministers and decision makers on the board. And therefore, there is the opportunity for sharing and asking them to become more of champions of this and people who are going to listen to scientific advice. Now, I think we are seeing this as an opportunity to do this, because when I look at the news in the evening, I see more and more around issues of the challenges for the continent and less on politics. We would all love for the predominance of science coming on board more and more is more. It's very interesting to see that happening. Even so, politicians have never really much cared about science. So it's good to see a lot more people coming on board to say, we are listening. We have put together teams. We are meeting them regularly. We don't quite understand what you mean by all the big sciences around immunology and epidemiology, but we are listening to you. So I think this is an opportunity for all of us to do the advocacy required to get, not just on the continent, but I think globally, science taking its place in terms of science advisory. And a part of that then, of course, filters into diplomacy, where you are then saying, well, there are many ways in which to bring people together. And if it is being driven around the grand challenges for Africa, then I think we can have champions who can have engaged with that and then take it forward, including unlocking more resources to drive the agenda. So there are opportunities for that.
Thank you. And it was very clear how you're working with researchers, with scientists, to get work done and to move things forward. And there's a question here that's requesting a bit of clarity of how exactly you engage, not just with individual sciences, but with research institutions themselves. Perhaps you can say a bit about the research institutional level.
Institutions, there are very many levels of engaging with institutions. So one is where, for example, we put out competitive calls. And of course, we have a winner who comes from an institution. The very first thing we do is we want to know through a very protracted due diligence, their preparedness to be able to support the researchers and to deliver on the objectives of the science that's going to be done there. So we do very detailed due diligence. So we have, over the last 5 years, done maybe now 100 of this kind of due diligence across the continent. Wherever we have 2,500, 3,000 researchers, where the money has gone, we have undertaken a due diligence of those institutions. One of the things we have found out, for example, is that, of course, I can tell you a lot more about who is in a mess, who is not in a mess, and I wouldn't get into the details of who is in a mess and who is not in a mess. But the point is that there are opportunities to then work with them to say, look, do you want to build your strengthening of your financial governance? Do you have policies? And would you want us to help you build your policies around, for example, gender issues, corruption and bribery, whistleblowing, bullying and harassment, safeguarding? So we have a checklist around all these issues. As they get into the implementation phase of a new project, the requirement for us is that they will keep ticking on these issues and how they are building how they are strengthening their own systems, their people and their systems and their policies on the ground. So that's one area of engagement that is very, very important. But of course, we also have many other opportunities to convene, institutions and working with the various groups, whether it is at the level of the African Universities Associations or the African Research Alliance for Universities in Africa. There are many groups we are working with.
Thank you. There are quite a few questions here, and I'm not entirely sure we'll be able to get through all of them. But for Katrina, there's a question here, a very specific question and a very interesting one that is asking, is there scope for integrating water quality monitoring with the last mile public health interventions, for example, vaccines?
Yeah, so that's a very interesting one. So we know, for example, that people, if I can get this right, that there's the rotavirus oral vaccine for children has been shown to be much less effective in Africa than it is in Europe. And part of that is thought to be related to environmental enteropathy and exposure to lots of pathogens, not just in terms of water quality, but also in the environment as well. So we see a real link in some ways between those, that in terms of making sure these vaccines are particularly oral vaccines, are effective in communities, that there is a high level of water quality and a high level of water sanitation and hygiene available. So they are very strongly linked. I think there's other ones things that link more broadly with water too, which I think are much less understood. And they come back to some of the challenges that Tom was outlining in terms of climate change, that we see. What we haven't looked at so far is the environmental changes and the impact they have on the spread of disease and the spread of risk, and also that perception of risk that people have. For example, we know that some certainly lots of diseases will have a seasonal link to them, and some of the work we've been collaborating on has been looking at the plague in Madagascar, for example, and looking then at what is the seasonality in terms of rats as carriers of that, and how is climate and sort of water management linked to that, also affecting the spread of that disease.
Right. Tom, I'll just come back quickly to you because there's a follow-on question from what you've just explained about institutions, but coming from a slightly different direction. And this is about British institutions. And the question is, how are British institutions partnering or engaging in equitable partnerships with Africa?
What the question? What
are the key ways for British institutions to become or to have equitable partners with African institutions?
Yeah, so I think I would recommend that anybody who would want to read and learn a little bit more about getting into equitable partnerships, that there are a good number of publications out there and principles that actually have been shared about how people can improve partnerships. So I mentioned, for example, that one of the concerns has been making sure that if we are working with communities, what are the benefits for the community? And there are lots of discussions around how one can do that. There are questions about if I get into a partnership with one of some good universities that have high visibility, and I am a smaller university that doesn't have as much visibility, how do I get into an equitable sort of partnership? Again, there are lots of discussions around there. But one of the things that I mentioned that we are doing is to make sure that even though we are building networks and there's a lead institution that is receiving the bulk of the money, we are making it sure that smaller organizations and partners who are coming from disadvantaged countries, they are disadvantaged institutions, are part of the network. That's just one way of being very intentional about how you build a hub and spoke model of bringing together a lead institution with a lot of partners. There has been, for example, discussions about whether stronger universities in South Africa should be collaborating more with universities in the rest of Africa. So again, lots of discussions going on around there. And one of the things we are driving is to make sure that those institutions, when they win, are actually bringing together a lot more partners. And you can then look at some of the 10 principles, for example, that UKCDR has built, and then we can sort of Google this and see the 10 principles championed by UKCDR.
Thank you. We are coming very close to the end of our time here, and there are still quite a few questions that I don't think we'll be able to get into, including questions around how to access funding at the Academy of Sciences, and questions around whether you only fund health sciences and whether there are other areas. I know there's plenty of information on your website about how to access grants, and that all those health sciences were very prominent in your slides, that you cover other areas, including environmental sciences and so on and so forth. So I'm just going to throw a last question to you and perhaps get a quick reaction, a very brief reaction. It would be interesting to get a sense of how you see the whole pandemic situation in terms of implications for your work longer term. Has it given your programs a whole new lease of life, or does it look more like a juddering halt for the moment? So is the pandemic, really helped you sort of see, more clearly into the future, or is it, made things look rather hazy?
Yeah, so that's a good question. And yes, we don't have time to get into all of this, but we have been looking at the impact of COVID on the programs. We have had a lot of discussions with the grantees. There are various levels. So some do not have access to the universities because the universities have been shut down, and therefore they are being sort of impacted that way. Others are saying, I need to go to the field and collect my data, therefore I'm not able to go to certain places during the lockdown. I think there are a bit of easing around many of these issues, and these discussions are continuing. And of course, we cannot, one of the things we want to make sure is happening is that the flow of funding from the academy to the grantees has continued and has not been much impacted on that level.
Thanks. Katrina, a last word from you.
Well, I think for us that, COVID has had hasn't had too much of an impact on our operations so far, thankfully. But I think it offers it's really highlighted how important water is in terms, and while I presented earlier that we have these, there's been a lot of progress in water across Africa, that there hasn't been enough, there's many cases where there hasn't been enough water for hand washing at the level that's expected with COVID. So it's really highlighting how essential water services are for all to keep all of us safe.
Thank you very much, Katrina and Thomas. That will be all from us today. And thank you very much for joining us. We hope to see you again next month. But for now, it's goodbye from us, and thank you.
Thank you, Watu. Thanks, everyone.